I don't remember if you mentioned that you expect the completion of a project is by next year, is it correct?
It is, by the end of October 2013.
By the end of October. And what are your expectations on top of the results you have received so far, you have achieved so far?
Obviously it's difficult to anticipate the future, but all these countries now have good relationships with their governments and are developing limited programs within a small number of hospitals and facilities within their countries. But they all have plans to upscale these programs through further districts and provinces to become national programs within their country. So that's in terms of the activities within the country. And we believe in the long term that they will have enormous influence in changing policy and practice in their country, to be as yet to be defined, because they'll now be established partners with their governments.
Thank you.
Yeah.
Please.
I'm Jean-Tis from Belgium. I have several questions for you both. First, it seems to be a new way of helping the third world. Thank you. Did you comment on it?
Yes, I think that's very true. It's an unusual project, an innovative way of trying to help low-resource countries. The classical approach is agencies coming in from outside, being there for a short while and then leaving. Whereas this is developing the capacity of the indigenous people within the country that already have intellect and skills, and being able to facilitate their more widespread impact within their countries. So it is an innovative approach. Would you agree?
Yes, I think that's quite right. If you have a structure which is really strong, which can function and work for improvement of policies and practices in any topic. If you just bring a consultant from outside, from Europe or America, to these countries and teaches them how to do it, and he goes, then I think you don't have any legacy left there of that project. It's completely disappeared. But if you build these capacities and knowledge into the people who are there, then of course you are going to sustain this activity for as long as they are active to do it. So it does make.
Please go ahead.
You said you had others.
You said you have several questions, so please.
Yeah, it seems to be the problem of fish and fishing.
Sorry?
If you
Fish and fishing, we don't know the analogy.
If you give a fish to people, they eat it,
yes.
And then it's over.
It's over.
If you learn them to fish,
teach them to fish,
Yeah.
then they go there.
Yes,
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 very
yes.
good analogy.
but it's not for me.
No, but I hadn't heard it before.
But in our countries, we have several professors, specialists, who are going to these countries and working themselves, maybe learning to do some intervention to people. But do you want those professors to be involved in larger projects like yours, or is it good to go by themselves?
No, there's no doubt that they do good, because there's a huge unmet need of service provision within these countries. Services are really weak. So when they do visit and do operations, say for 2 weeks, or do clinics for 2 weeks, they are doing good, but they're not building the capacity of the country. So that they should, when they're there, be passing on skills, passing on knowledge, as well as actually doing the clinical service work. So I wouldn't diminish the work that they do, but in terms of having a legacy and sustainability, you have to do more than that.
You spoke about relationships with government, but as far as I know, some government are not concerned with the well-being of their people. How are you doing it?
Hamid would be able to speak to that.
Yeah. I think you are right, because in many of these countries you are working while the budget for health is very low, and the budget for security and army is 80 and 90% or so, huge. So I think they are not caring for the welfare of the countries. But now there are attempts, especially pressures from the international community, who gives money to them to support their health services, that they should put part of their budget, increase the budget. For example, the budget could be only 1% for health for the whole country. Now they are going to increasing a bit to 5%. There is a target that by 2015 they reach 15%. But still, 15% is not enough to cover the all of healthcare systems, and that's why the services are really not good. So I think there is pressure now that they're going to do it, and the pressure sometimes comes from projects like this, because as David told you, that the government was not taking care of this, and the association together with other partners managed to push the government, at least in paper, to commit to increasing the annual budget to 30% from what level it was. Might be even. So that's a step forward here.
Okay, thank you.
One last.
Sure. Go ahead.
You've got the chance today.
Yeah.
Some organization like IDF, International Diabetes Federation, got much
Diabetes Federation.
Oh, yeah.
they got much money from the United Nations. Do you do the same, or do you get the same support, or what's the difficulty?
Comparing between obstetrics and gynecology and diabetes.
Yeah.
Yeah.
Well, the International Diabetes Federation is a charity, and it's supported mainly by industry, not the United Nations.
Not the United.
Yes, and we are part of it because they are giving us a grant so that we can use it into improving management of diabetes during pregnancy through education, training, guidelines, and all this sort of thing. So we are aware of this. They are so well supported by industry, but they are a charity, and we work together very well.
Thank you.
Thank you.
Okay, and I can tell you as I work for Vita in the IDF as well, for it, that what Professor Tello said is true. Basically, the industry supports, because diabetes to be behind the industry is much more important than gynecology. This is sad to say, but it is like this, basically. Of course, diabetes people is happy about this.
Yeah, of course. Of course, we would be the same.
For sure.
Yeah.
Okay. Okay. Well, if Marta, don't you have any question? No, that's okay. That's okay with you. Okay. I think that we have covered this initiative. I had a question in the beginning that I never sorted an answer out of the criteria for the selection of the 8 countries, which is probably because, Professor Rusha said that a lot of countries are asking to enter the project. And my question was the selection criteria for the 8 countries you selected at the beginning was?
The main criteria is high maternal and newborn mortality rates. So and they had to be from Africa and Southern Asia, and that's where the
And-
majority of maternal deaths do
And
occur.
these are the countries with the highest maternal.
Yes,
Okay, that's it.
88% of all maternal deaths occurs in sub-Saharan Africa. So
Yeah, okay.
it's where the biggest burden is.
Okay, thank you, because this is a curiosity I had since the beginning. I never. Having this said, thank you to Professor Rushwan, thank you to Professor Taylor, thank you to you all, and we expect tomorrow for another press conference, because today we covered the two topics we had on the agenda. Thank you very much, and
Thank you.
have a good day.
Thanks very much, Diego. Thank you.
That's all.